Bismillahirrahmanirrahim. Assalamu alaikum. Today our topic is fracture. A fracture is a medical term used to describe a broken bone. It occurs when there is a disruption in the continuity of the bone due to forceful impact, stress, or disease. Fractures can vary in severity, location, and type. Types of fracture. Closed fracture. The broken bone does not pierce through the skin. Open fracture. The broken bone protrudes through the skin, increasing the risk of infection. Green stick fracture. Common in children where the bone bends and cracks but does not completely break. Communicated fracture. The bone shatters into multiple fragments. Hairline fracture. A small crack in the bone that is not easily visible. Stress fracture caused by repetitive stress and overuse, common in athletes. Compound fracture. Another term for an open fracture where the bone breaks through the skin. Signs and symptoms. Intense pain at the site of injury, swelling, bruising or tenderness, deformity or visible bone misalignment, inability to move or bear weight on the affected limb, loss of sensation or numbness, grinding or grating sensation during movement, open wound or bleeding in the case of an open bone fracture. First aid treatment. If you suspect a fracture, it is important to provide appropriate first aid before seeking medical help. Here are some first aid treatment steps. Immobilize the injured area. Encourage the person to stay still and avoid unnecessary movement as it can worsen the fracture. If possible, immobilize the fracture area using a splint or makeshift splint made from rigid materials like wood, rolled up newspapers or cardboard. Elevate the injured limb. If it is a limb fracture, elevate it gently to help reduce swelling. Apply ice packs. Place a cold pack or a bag of ice wrapped in a cloth on the injured area to minimize swelling and relieve pain. Apply it for 15 to 20 minutes at a time with breaks in between. Control bleeding if presents. In the case of an open fracture with bleeding, apply direct pressure to the wound using a clean cloth or sterile dressing until medical help arrives. Seek medical assistance. It is crucial to get professional medical attention as soon as possible. Call for an ambulance or transport the person to the nearest emergency room for evaluation and proper treatment. Remember, these first aid steps are meant to stabilize the injury temporarily. Only a medical professional can provide an accurate diagnosis and appropriate treatment for a fracture.